Hi, my name is Jamie Blackman, and today I will be doing my report on a very rare disease that affects my life every day. I am doing my report on Maroteaux-Lamy, or MPS 6. It is a disease that my son was diagnosed with a little over a year ago. Maroteaux-Lamy is a progressive condition that causes many tissues and organs to not only become enlarged, but then they become inflamed, and a lot of times they become scarred. Skeletal abnormalities such as shortness is very common in these patients. Most of them never reach over 3 to 4 feet in height. The rate at which most of these conditions affect these patients each depends on how the gag builds up in their system. It depends on how quickly they receive treatment and whether they choose not to even have treatment. Maroteaux-Lamy belongs into a group of rare inherited diseases called lysosomal storage diseases. A lysosomal storage disease is a disease that affects the lysosome, where there are enzymes in our lysosome, kind of like garbage trucks, and they eat up different things, different parts of garbage or waste that is built up in our lysosome. The best way I've ever heard it described is you've got several garbage trucks that represent an enzyme. When one of those garbage trucks is missing, there's a particular piece of trash that never gets picked up. Over time, that trash continuously builds in these different lysosomes. Then the lysosomes continue to attach to organs, they attach to the joints, and they attach to other parts of the body. So it's never really dissolved out of their system. It just continuously builds. In the case of Maroteaux-Lamy, the person is either missing all or has very small amounts of this enzyme being produced. More so, none at all. The enzyme called sulfatase B is what is missing in Maroteaux-Lamy. It is the one that breaks down the complex sugars called GAG. GAG plays an important role throughout our body, providing structure to our skin, our airways, our bones, and other organs, and they continually have to be recycled and replaced. In MPS 6 patients, the excessive buildup of GAG causes widespread symptoms that normally emerge through infancy or childhood. Most patients are not diagnosed until they're in their early childhood years. Some of the most common side effects, as I said before, are short stature. They normally stop growing between the ages of 6 and 8, not always, but most do. On severe cases, they will never reach over 3 feet. Gradually coarsening of the facial features, which includes a broad nose, flat nasal bridge, thickening of the tongue, the lips, large heads. Some of them end up getting hydrocephalus, which is water on the brain. Short necks, and some of them have prominent eyes, where the eyes tend to look almost like they're bulging out. The eyes also tend to always end up with corneal clouding, which causes them to eventually, over time, go blind if they do not have corneal surgery to repair it. They can also have optic nerve and retinal damage as well. They get frequent ear infections, which tend to cause them over time to lose their hearing because of the scar tissue that builds up from all the infections. They also have sinus infections, and a lot of them are prone to pneumonia. The reason is because even though their organs continue to grow into adult life size, their body does not. It causes them to have the shorter upper bodies, so the organs start to compress and they don't have room to move and grow. So with it restricting that, it also causes them to start to thicken and harden. By thickening and hardening, then it doesn't allow them to produce as much air to get up. So a lot of them you will see as they get older are short of breath a lot, or they seem to sound like they're wheezing when they breathe. A lot of them have sleep apnea issues. They tend to have their tonsils and adenoids removed at early ages, just so it gives them the more ability to breathe longer. A lot of them end up having heart murmurs, or they have valves that tend to block or harden due to the fact of the gag constantly building up in that area. A lot of them end up with valve prolapses, or where the valves start to close and they can't get them to open as well due to, again, the gag building up. They tend to have bulging of the abdomen because the spleen and the liver tend to enlarge, and that's the gag, again, building up in the spleen, because they're trying to get rid of it. That's what their job is in our body naturally, and it just can't get rid of it. They tend to get hernias due to everything being so compact in their little bodies, and their teeth tend to also be really widely spread apart, and they tend to look like they don't have a lot of enamel to their teeth, and that's just from their body not producing it properly like it should. The number one cause I see in any of the MPS patients I've ever come across is stiffness in their joints, their knees, their elbows, their legs, and that's because that's the number one place the gag attacks first, is any kind of joint. So even your spine, a lot of them end up with spinal compressions and having problems with the spinal joints kind of almost fusing together, not giving them a lot of movement. The life expectancy of an individual with MPS 6 is unknown. It depends on the severity. It depends on whether they have treatment to slow the progression. On average, they can live into their adulthood. I was told some of them lived to be in their 40s. I think the oldest was in their 50s. How is MPS diagnosed? It is diagnosed through multiple blood tests, urine tests, and some of them even opt to have skin biopsy tests. How do we treat it? There are several ways that you can try to treat it. The number one treatment is an infusion treatment of the enzyme, a synthetic enzyme called Nicholson. Nicholson is infused either IV or through a port. With the Nicholson, it goes through every week. It is a 4.5 to 6 hour treatment depending on how well the patient takes the treatment. They have to go through it being infused, and it goes into the bloodstream, kind of tries to get out what waste it can for the week. By the end of the 7 days, it's out of their system completely, and they start over. That is the number one treatment that is being used now. It is not a cure. There is no cure for this. They are trying to work on one, but it's a long way down the road. The next treatment, if they can catch it early enough, is some patients have what they call hematopoietic stem cell transplant. And that is where they take stem cells from somebody who's not affected with the Maroteaux-Lamy, and they inject it into them, but normally they have to be under the age of 2. A lot of times it does not work either, so a lot of people opt not to do it because there are so many risks and dangers of injecting something like that into the body. Some of the symptoms, if treatments are not done, which a lot of people do opt not to even consider a treatment to slow it, is that it can eventually cause irreversible disabilities. It can cause blindness, it can cause deafness, and paralysis. Some of the support systems and sources that are out there for parents for this disease are from companies such as Nord, BioMarin, the MPS Society, and the Rare Disease Organization. Not only does it help parents come together to try and communicate and to have support for each other, but it also has a support system for the patients, and it also has some kind of financial assistance. The Nicholson enzyme treatment is averaged on $365,000 a year is the cost. It takes 6 months to make 1 bag of this treatment. And imagine, they have to go through 52 bags in a year. Wow. In the last year, I have learned quite a lot about this disease, not only firsthand, but through other people. And I hope that one day science will continue to advance and we can learn more and eventually find a cure for this disease. I hope that I have been able to give you all some sort of sense of knowledge and to make you more aware of genetic diseases that we don't know about till we were struck down with them. I hope that one day you'll start to research other lysosome diseases and rare genetic diseases and help push for having children tested when they're born for a lot more genetic diseases. Thank you.